Hey folks, this is Dr. Makuve, physical therapist and adjunct professor at Touro University. Today I have a presentation for the students who are taking the integumentary class. At this point we're working with pulse lavage, and the purpose of this particular presentation is to go through the steps that are required to successfully go through the checkout that's coming up on pulse lavage. So let's get right into it. So the first thing that you want to do is make sure that you're prepared. Just as you're going to be prepared for anything that you're going to be doing as a PT, you want to make sure that first of all you have a clear understanding of the indications and contraindications for pulse lavage. So go through those in your text, make sure that you understand those. Be ready to explain the modality to your patient and or your patient's family. And then at the same time be able to explain the goals of the treatment. You will need those for documentation, and whether that's just for the next clinician who's going to be treating your patient or for a third-party payer, you definitely need to make sure you can articulate those. Now, let me be clear, you don't really need that in this particular checkout, but it's just good practice to understand why you're going to be using a particular modality and what the goals are going to be. What is pulse lavage? It's non-selective debridement, or debridement as some people would say, using pressurized, pulsed, hence the name pulse lavage, solution to irrigate and debride or debride non-viable tissue. So the first thing you want to do is really gather your supplies. Make sure that you have everything that you need for this particular task at hand. Make sure that you have your PPE, the pulse lavage unit itself. You have a clean working area, unless the referring physician is asking for a sterile environment. Then you want to make sure that you do have a sterile environment. Now, just one tip here regarding a sterile environment. Remember that the actual pulse lavage unit comes in a sterile container. So even if you had, especially because we work mostly at bedside, even if you had a clean area, as long as you do not contaminate the inside of the actual unit, of the container that's holding the unit, you should be able to keep a relatively sterile environment. And we can talk about that in class, and I can show you how to do that. Now the process is really simply, go in and wash your hands before you don the gloves. That's pretty standard stuff. Introduce yourself to the patient. Explain why you're going to use pulse lavage and how it works, and then again go and obtain consent from your patient. So this is a really simple process. In my case, I would say my name is Ephraim. I'm a physical therapist, and the reason why I'm here today is to see if we can speed up the process of your wound healing. And today we are going to use a device called a pulse lavage, and the way it works is literally we introduce some saline solution into the wound using pressure, and then we suction all the loose material that's in the wound that is causing your wound not to heal. Now, is it okay for me to proceed with this treatment? And your patient says yes, then you can go ahead and proceed with the treatment. So work on what you're going to be saying to your patient, so that your patient kind of has an idea of what you're about to do, and why you're doing it. Now make sure that the suction pump is operational. Now that's the mechanical device itself with it's got a pressure gauge and a power switch, and you want to make sure that of course it is running, and that the pressure is set at the correct pressure for what you're about to do. Go ahead and hang the saline bag. Now remember, you're still doing this with just one set of gloves, and then prepare your work area. In other words, if there's anything that you need to place in a specific area for doing this, you want to make sure that you do this, and you're doing all this with just a clean pair of gloves, one set of gloves. Once you're done with all this, you're going to open the pulse lavage container away from you, and you're basically opening the lid or the cover away from you. And at this point, you can now remove your gloves, wash your hands, don your PPE. Now, making sure that you don't touch the lavage gun, remove the unit, remove the tubing out of the container. Remember, you're using one set of gloves now. That is, this is a set of gloves that you will not be using to actually touch the lavage gun itself or the tip. This is the the pair of gloves that you're going to be using to hang and do all the troubleshooting that you need to do. So you're on your second pair of gloves right now. Now attach the tubing to suction, and then go ahead and spike the bag. So now you got the two tubing units are attached correctly. One to the suction unit, and one is spiked in the bag. Ensure that all clamps are open. Now this is something that a lot of students will always, well, not always, that they will forget and then wonder why there's no suction. And then now go ahead and turn on the suction unit, making any necessary adjustments to the pressure. Remove the gloves. Now the reason why you're removing the gloves here will become very evident in a very short period of time. Remove your gloves, wash your hands, and don a new pair of gloves. Now this is the final pair of gloves that you're going to be using, because with this new pair of gloves you're going to remove the pulse lavage unit itself with the new gloves and test if the unit is working. You do this by pressing the trigger while pointing into a receptacle. This could be just an open container, or you could do this in the same container that the pulse lavage unit was coming from as well. Now, if any adjustments need to be made at this point, place the lavage unit back into its clean tray, or I should call it a sterile tray at this point. Proceed to troubleshoot with the third pair of gloves that you were wearing. But before proceeding to handle the unit again, I want you to remove the gloves and don a new pair of gloves. This would make this the fourth set of gloves that you're going to be putting on. Proceed to debride the wound until the saline bag is empty. Remember to ask the patient what their pain level is at any given time during this, because you want to make sure that your patient is not uncomfortable during this. Now let's wrap it up. Return the lavage unit back into the tray, and then go ahead using the same pair of gloves, removing any gloves here. Use the 4x4 gauze to remove any excess water in and around the wound, starting with inside the wound and going out. When you're removing any excess fluid from the outside of the wound, you want to be wiping away from the wound, not into the wound. Remove the tubing and roll it back into the tray. Turn off any electrical equipment, and then go ahead and empty the canister. Again, another thing that students sometimes forget is to empty the canister. Wipe any fluid on your working area using we should have some rags there. You can collect some rags to wipe your area so that it's clean. Now, some of the tips that I will give you here is avoid contaminating the wound. This is usually done when a clinician touches equipment, which by definition, any equipment that is in the room, we're not sure of the sterility of the equipment, so we just always assume that the equipment is not clean. That is the most prudent way to make sure that your patient doesn't end up with some foreign organism that wasn't in their body to start with. Wash your hands and don new gloves before you touch the patient, and always ask for consent to treat the patient. Now, in this particular situation, when we're doing this, obviously we could go through many sets of gloves. We don't want to do that, so please declare when you notice that you've contaminated your field, or when you need to change gloves. In the interest of time, you can declare to us that at this point I would take off my gloves, I would wash my hands, put on a new set of gloves, and then I will proceed with the task. But that will suffice for the purpose of this checkout. Obviously, in the clinical setting, you want to make sure that you actually do that. With that said, I wish you the best of luck. Thank you for watching this video. And if there is anything at all, any questions, anything that I left out, please just put it in the comments below. And I will see you on Tuesday next week. Thank you.